Hello, Dr. James Bogash, expert in health and longevity, and anybody who's followed any of my stuff for the past 20 years knows that I'm generally not a big fan of the statin class of drugs to lower cholesterol for a variety of different reasons. First of all, they really kind of suck. If you look at absolute risk reductions, meaning how many people truly benefit, the numbers all fall out to about every 1,000 people you treat, 11 people actually benefit. So if you didn't treat them, 22 people would have a heart attack. If you do treat them, 11 people have a heart attack. So while that's a 50% reduction, only about 1% of the people taking it actually see a benefit, which means any side effects, if there's no benefit, are unneeded, unwarranted side effects. I'm not sure how this class of, again, let's look at this. If they were such the wonder drug, why is cardiovascular disease still the number one killer? It's because they suck, and everything that has to do with heart disease has to do with lifestyle. So in reality, I don't like them because they make patients think that the problem is fixed, and it's not. We clearly see that people who take statins have poorer lifestyle choices because they think that it's fixing the problem, and it's not. So when we look at other studies like showing that statins clearly increase the risk of diabetes, I always say for every 11 of those patients that were benefit, another 8 will develop diabetes out of that 1,000 group. And the real challenge with lipid issues, cholesterol, triglycerides, is that they are at their heart pre-diabetic issues. So what we really need to do is fix the diabetes trajectory. That means that any drug that increases the risk of diabetes is the problem in the first place. So it just seems crazy. In this particular study, they looked at 40 people that were specifically Asian community out of Hong Kong who already had diabetes, 40 years of age or older, and they compared it to people who weren't on statins. And they followed them for 10 years, and they found some challenges. Is that the people on the statins had a 44% higher risk of having renal complications, which kidney problems, just they're life-changing. They're devastating for such a tiny organ. If you've ever wanted to, if you had no care about protecting your kidneys, you need to spend a little bit of time in a dialysis unit. Ophthalmologic eye problems, complications were increased by 44%, and neurologic complications, so think diabetic neuropathy, 47% higher. This is crazy. If people were exercising, dieting, and eating better, then these complications would drop, not increase. So it just goes to show that statins are not the answer. And if that's all we're doing to manage cholesterol issues, then we need to look another direction because it's not fixing the problem, and it's creating brand new ones that didn't or were less likely to exist before somebody was on these HMG coenzyme A reductase inhibitors that also block coenzyme Q10 or CoQ10, which is known as ubiquinone because it's in every tissue. It's required for every tissue to generate energy. It just doesn't make any sense to me. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.